I'm having a hysterectomy tomorrow, but I don't really know much about it.
That's okay. I'll go through it with you now. What do you already know about the operation?
Well, I've got fibroids and I've had a lot of problems with heavy bleeding. Heavy periods, I mean. I'm a teacher and it's really affected my work. I've had a lot of time off work because of it. I know I am having my uterus removed, but I'm not sure how the operation is done.
You're having a laparoscopic hysterectomy. The hysterectomy part means removal of the uterus, as you already know. The operation will be performed as laparoscopic surgery. This means that you won't have a large cut made into your abdomen. Instead, the surgeon makes a few small cuts in the abdomen where a laparoscope can be inserted.
I'm still not sure I understand how the surgeon can remove the uterus.
The surgeon inserts a laparoscope into one of the incisions. This is to have a good view of your internal organs. Then, surgical instruments are inserted into the other incisions so that your uterus can be removed.
Okay, I understand now. What about afterwards?
You'll stay in hospital for a day or so, until you're ready to go home. You'll have some small, waterproof dressings over the incision sites, which usually stay in place for about a week. You can have a shower with this type of dressing, but you shouldn't have a bath.
How long does it take to recover from the surgery?
Recovery time after laparoscopic hysterectomy is shorter than for an abdominal hysterectomy. However, you'll find it can take up to 2 months to fully recover. You should make sure that you rest every day, and avoid heavy lifting during this time.
Is there anything else I should be aware of?
Yes. After surgery, some women find that their bowel habits change a bit, and they become constipated. It's important that you don't strain when you go to the toilet, especially soon after the operation. You may need to take a laxative to prevent this.
All right. I'll keep an eye on that.
After the operation you'll have some vaginal bleeding, like a period. It may last up to 6 weeks. Wear a pad during this time, rather than using tampons. And make sure that you report any discharge, which is a strong smell.
Why is that?
It may mean that you have an infection. Speak to your GP, who can prescribe some antibiotics for you, if it's appropriate.
What about driving? How soon can I drive my car again?
You shouldn't drive your car until you can comfortably wear a seatbelt and can perform an emergency stop. Most women find they can return to driving from 3 to 8 weeks after their hysterectomy.
All right. I'll see how I go then.
The last thing I should mention is when you can have sex again. It's best to wait until the vaginal discharge stops. Then, it will be okay to resume sexual relationships. The good news is that studies show that after a hysterectomy, many women report a reduction in painful intercourse and an improved libido.
I hope so. Having fibroids has caused a lot of pain, and I certainly am looking forward to not having heavy periods anymore.
I can imagine that it must have been extremely difficult. I think I've covered everything you wanted to know. Did you have any other questions about your surgery?
I don't think so. Now I understand what will happen tomorrow and how I need to look after myself after the operation.
Great. If you think of anything else, you can ask me later. Just ring the buzzer next to your bed.